Okay, I just wanted to go through this lecture and point out some of the big points you should be familiar with as far as the bacterial pathogens. So we started by talking about the streptococci. Again, if you see streptococci or staphylococci, you automatically know that they are gram-positive. Okay? The first one we talked about was Streptococcus pyogenes, also known as Group A strep. Strep pyogenes causes a couple of important infections, one being strep throat, which is bacterial pharyngitis, also skin infections. Okay? Necrotizing fasciitis, that's that flesh-eating disease, and also things like scarlet fever and rheumatic fever, which are a complication of strep throat. A lot of people don't know the streptococci group A strep can also cause toxic shock syndrome, so that's also important. And again, this little note over here about the antibiotics, don't worry about that. Okay, then we talked about strep agalactiae, can cause meningitis and pneumonia in newborns because it's a normal flora of the vaginal tract. Streptococcus mutans, number one causative organism of subacute endocarditis, as well as it's important for the formation of dental caries, which are cavities. Again, anytime you see number one causative organism, definitely know it. Okay, then we talked about Streptococcus pneumoniae. Again, gram-positive, number one causative organism of a lot of diseases. A couple of important ones: lobar pneumonia in adults, also bacterial meningitis in adults, also sinusitis, otitis media, very important human pathogen. Okay, Enterococcus, again, these are still gram-positive. These are normal flora of the GI tract. They're associated with things like UTIs, typically nosocomial urinary tract infections, and then VRE. So definitely know what VRE stands for, and that stands for vancomycin-resistant Enterococcus. Okay, then we talked about the Staphylococci. Again, these are gram-positive. And the first one we talked about was Staph aureus, very famous pathogen. And Staph aureus causes things like skin infections, toxic shock syndrome, can cause a type of food poisoning, which isn't an infection, but it's more of an intoxication. And it's also the number one causative organism of things like osteomyelitis and acute endocarditis, infective arthritis. So definitely be familiar with those. Okay, Staph epidermidis. Very good at forming biofilms, and because of that, it likes to affect things like prosthetic heart valves and prosthetic joints. Can cause some skin infections. Typically, the infections with Staph epidermidis are opportunistic because Staph epidermidis is a very common bacteria to have on the skin. Then we talked about Staph saprophyticus. The big takeaway here is it's associated with UTIs, especially in young sexually active women. Then we talked about the gram-negative cocci. So obviously these are gram-negative. So a couple of important ones here: Neisseria meningitidis. You should associate this with epidemic types of meningitis. And then we talked about Neisseria gonorrhoeae, which is the causative agent of gonorrhea. And with that, it can also lead to pelvic inflammatory disease. And it is the number one causative organism of septic arthritis. And this is seen mostly in young females, especially in the large joints like the knees. Okay, then we started to talk about the spore formers, okay? And I told you if you see bacillus or you see clostridium, at least for our purposes, immediately think this is a spore former. And if you know it's a spore former, then you know it's gram-positive. So if you see bacillus or you see clostridium, you already have a ton of information, okay? Now, the first one we talked about was Bacillus anthracis, which causes anthrax. There are a couple of different forms of anthrax: cutaneous anthrax, which is affects the skin but can be fatal, and also respiratory anthrax, which is when the spores are inhaled, and that's very highly lethal. Then we talked about Bacillus cereus. The big takeaway here is it causes a type of food poisoning. Clostridium perfringens causes gas gangrene, and then Clostridium tetani causes tetanus, and that's due to the release of a toxin known as tetanospasmin, which causes spastic paralysis. Okay, Clostridium botulinum causes food poisoning, but this food poisoning is typically due to improper canning of homemade foods. Okay, and what happens is the spores are in the food and they're improperly canned, and the spores will germinate, produce botulinum toxin, and then that is consumed with the food, and that can be fatal. Now, infant botulism is a true infection. You don't need to worry about that, but it is a true infection. Then we talked about Clostridium difficile or difficile, shortened to C. diff. This is the number one causative organism of antibiotic-associated colitis. Okay, then we talked about some non-spore forming gram-positive bacilli. So Corynebacterium diphtheriae causes diphtheria. Again, this is gram-positive but does not form spores. And also Listeria monocytogenes, which causes listeriosis, which is really a type of food poisoning. It can also cause infections in newborns, like meningitis, but don't worry about that. Okay, then we talked about the gram-negative bacilli. A lot of these will be normal inhabitants of our GI tract. And the first one we talked about was Escherichia coli, which is E. coli. And there are many, many, many strains of E. coli. And they cause many different infections from, pneumonia, meningitis, all sorts of GI infections. But the big takeaway I told you is this is the number one causative organism of UTI. Okay, Klebsiella pneumoniae causes a pneumonia that is characterized by what's called a thick currant jelly sputum. Okay, it also causes things like UTI and some other infections, but the big one is that special pneumonia. And then we talked about the Salmonella species, starting with Salmonella typhi and paratyphi, which causes typhoid fever, also known as enteric fever. Not to be confused with Salmonella enteritidis, which is the salmonella you hear about in the news. Okay, so it causes the GI type infections, the enterocolitis. Alright, then we talked about the Shigella species, which causes shigellosis, which is also known as bacillary dysentery. Okay. Remember, what makes dysentery is it's basically diarrhea with pus. Okay. And again, don't worry about Reiter syndrome. Very rare. It's just a type of reactive arthritis. Alright, then we talked about Yersinia pestis, which causes the plague. And there are a few types of plague. There's bubonic plague, septic plague, pneumonic plague. Septic plague is typically a result of untreated bubonic or pneumonic plague. Okay, highly lethal disease if it's not treated. Even if it is treated, the prognosis isn't the best. And the bubonic plague gets its name because of these large swollen lymph nodes, which are known as buboes. And over here you can see some gangrene of the toes, and that's how it got its name, the Black Death. Okay, Pseudomonas aeruginosa. A lot of infections here can cause anything from UTIs to pneumonia to skin infections. But the big ones here, corneokeratitis, which is an eye infection, swimmer's ear, which is external otitis, and also burn wound infections. Those are kind of important Pseudomonas type infections. Vibrio cholera causes cholera, and cholera is characterized by diarrhea that is typically painless, and it's described as being rice water diarrhea, and that's just because of the flecks of mucus that have sloughed off the GI layer. Okay. And if this is, this can be fatal because of rapid dehydration. Okay, I told you not to worry about Campylobacter, and then Helicobacter pylori, H. pylori, very famous pathogen, number one causative organism of gastric and duodenal ulcers, and also the number one causative organism of chronic gastritis. Pasteurella multicoda causes what's known as cat bite fever, which is just really an acute form of cellulitis from cat bites. And then Bartonella henselae, this causes cat scratch fever. And those were the only two on this slide. Haemophilus influenzae, number one causative organism of epiglottitis. It can also cause pneumonia, sometimes causes cellulitis, meningitis, but number one causative organism of epiglottitis. That's the big one. Bordetella pertussis causes whooping cough. Whooping cough is characterized by these bouts of severe coughing. And then in between these bouts of coughing, patients are typically pretty normal. And the name whooping cough comes from after the coughing fit when you inhale this huge rush of air that makes a characteristic sound. So the only one on this slide was Legionella pneumophila, which causes Legionnaire's disease, which is an atypical pneumonia characterized typically by lower lobe involvement in one lung. Okay, then we talked about the spirochetes, the first one being Treponema pallidum, which causes syphilis, and then Borrelia burgdorferi, which causes Lyme disease. Talked about Borrelia recurrentis, which causes relapsing fever, and then Leptospira interrogans causes leptospirosis. And again, those spirochete diseases tend to be very complex diseases when they're untreated. Very interesting. Okay, then we talked about the acid-fast bacteria, starting with Mycobacterium tuberculosis, which causes tuberculosis. So obviously tuberculosis is typically a lung disease, but it can go outside of the lungs. And you might see manifestations like scrofulas, which are these very swollen, painful lymph nodes that sometimes abscess. And then Mycobacterium leprae causes leprosy. There are a couple of forms. There's the tuberculoid form, which is less infectious, and then the Leprotomus leprosy, which is more infectious. And that's the one that you hear in the biblical stories and things like that. So over here, this is the tuberculoid form, and this is the Leprotomus form over here. Okay, Mycoplasma pneumoniae, walking pneumonia. That's the big association here. And again, Mycoplasma pneumoniae has no cell wall, so it's not gram-positive or gram-negative technically because it doesn't have a cell wall. Okay, and then I believe I told you not to worry about Mycoplasma hominis. So Rickettsii causes Rocky Mountain spotted fever, which is a tick-borne illness. And then Q fever, I told you not to worry about that. Chlamydia trachomatis causes chlamydia. And then Chlamydia psittaci causes what's known as parrot fever or psittacosis, which is usually due to the inhalation of the dust from infected birds. And it can cause a very severe pneumonia. All right, as always, if you have any questions, please let me know.